to an episode of CEO Unplugged. I am here with Ahmad Bani, and he is the CEO of Wisp. And it's one of my favorite kind of companies because anything with a very simple name just draws you in, and you're like, okay, what is this all about? So first of all, thank you so much for taking the time to chat with us today.
Absolutely excited to be here.
And I know you've been with the company for a while, but you're newer as CEO. I mean, is this a really exciting time for you? It's a company, as we'll explain soon, that is something that requires kind of passion, you know?
Yeah, absolutely. I think that the coming out of the pandemic, telehealth saw this amazing explosion of adoption. The industry was accelerated. I think Wisp has been a great force in helping with that adoption. And as a sexual and reproductive telehealth company, this really is the year where that's coming to the forefront. So it's a very, very exciting time to be in the industry.
So that kind of like gets into what my first question was going to be. What is Wisp? It's a telehealth company, a sexual health telehealth company.
Yeah, so we've been around since 2018, focused on sexual and reproductive health, which really are two of the most stigmatized and taboo areas within healthcare overall. We pride ourselves on being your partner in care for all of your reproductive and sexual health needs. Today we have 10 different verticals that we have offerings in. All of this is done over telehealth. And very, very big focus on our mission of making healthcare accessible to Americans.
So would you say that's like your biggest goal? Like I know you guys are super like mission driven. Is that the number one, or what are some other goals of the company?
Yeah, it all centers around access. I think access to healthcare in the U.S. is the problem that we're working on. And there's a few different elements that come into play here.
Mhm.
You can think of it from a capacity perspective, a cost perspective, a geographic availability perspective. From a capacity perspective, the healthcare system is overburdened. In many big metropolitan areas, the wait time to see your primary care doctor is between 30 to 40 days.
Yeah.
And when you're dealing with one of these sexual or reproductive health outbreaks that we treat, you're really looking for same day relief. That same day, there's an urgency to getting relief for your indication.
Right.
And the emergency room is just a very uncomfortable place to be when you're dealing with something like this. Cost is another really big thing that we pride ourselves on making sure that this is affordable, whether you have insurance or not. And geographic availability is another big part of access that isn't always thought about, but there are very much healthcare deserts in the U.S. and there's sexual health deserts as well.
Yeah.
And we're seeing that even more this year. And so Wisp has created a cost-effective solution that offers a doctor consult in 2 to 3 hours, same day treatment in all 50 states in the US and all zip codes in the US. And underscoring all of that is a foundation of quality care.
I mean, that's huge. I feel like without knowing in advance, you wouldn't know the crappiness of the handling of the situation until you're in it. And unfortunately, just because it has to do with sexual health, it's also severely like under discussed, in our personal lives. And it's kind of a big thing. You don't want the problem solved when it needs to be solved. You need what you guys are doing, which is to solve it in advance. And then
Mhm.
and then I'm glad you're there the day I need you kind of thing.
That's right.
So what is it that Wisp is doing to increase access to sex education, which is just, again, gigantic, especially when it comes to the mental facet of it. And it is a huge year for that in light of the overturned RV Wade earlier this summer.
Yeah, for sure. We at Wisp believe that access to quality sex education is imperative, and especially given what you just suggested about how stigmatized and undiscussed many of these topics are. And so, for us, we partner with students on campuses in states like Massachusetts, New York. We partner with organizations like Psychus, their Sexual Education for Social Change, New York Birth Control Access Project. Through all of this, we provide people of all ages with the resources they need to learn more about sexual education.
Amazing.
with a big focus on destigmatizing these conversations about sexual health in the process as well.
Wow.
And you know, our recent launch of medical abortion in 7 states, soon to be 10 states across the U.S., especially in the wake of the Dobbs decision this summer, was another critical step to increase education and resources for safe medical abortion for those who need it.
Incredible. Yeah, you guys sound like you're not just there on the medical end. You really are starting, you guys are kind of a whole picture situation, and that's not only really comforting but extremely important, because you're useful to anyone no matter what situation they're in, whether they feel completely healthy today, but just need a little bit more of an education and a little bit more comfort around an idea, or again, unless they need you medically. And that's just incredible. So you guys recently, you have some advocacy campaigns. I know you were just kind of talking about that. Um, how do you guys, show up and really give like all around related sexual health awareness to the rest of us? I know you kind of touched on that in the last answer.
Yeah, no, for sure. Holistic approach to healthcare really is the future of healthcare. And whether you're talking about the immediate treatment that we provide, or the education beforehand, or even post-care and the post-care check-ins, all of that is built into the patient experience that we think about. It's one of the interesting stats is that we've seen is 25% of the patients that come and use Wisp actually weren't treating their conditions before they came to us. And we
Get
really
out.
see that
That's so high.
it's a super high number. And we see that as a symptom of the lack of education, and lack of access. And so that's a really big part of what we're doing. Another thing in terms of the destigmatization angle of this, earlier this year, we launched the Say Vagina campaign, to encourage people of all genders to use medically accurate language around vaginas and destigmatize the conversation around sexual health. And so, a number of our campaigns revolve around this type of, opening up of the conversation and education around what we're working with here.
So this isn't like exactly what you guys are talking about, obviously, but it just struck a chord with me personally. I'm getting married in a month, and my fiance and I are, of course, talking about, you talk about family and what different goals are and whatnot. And I said, I don't plan on having any cute nicknames for any private part because statistically speaking, kids who don't use, penis, vagina are even less likely to be aware of when they're being, in a sexually compromising position from a stranger. It sounds
That's a
like
great point.
as adults now, that has evolved into different issues for us, which is just mind blowing to me. I get the reason people would want to do it, but yeah, we don't really, unless you seek out the education as to why it's not a great thing, who would even know?
Yeah,
Yeah,
absolutely.
that's incredible. Wow, adult problems now coming from this. So how does telehealth impact the future of healthcare? I feel like that's where a lot of companies are going. This is a huge way for us right now.
Yeah, absolutely. I think that, in terms of the future of healthcare, moving towards this more proactive approach to healthcare and this more immediate approach of let's treat our patients where they are rather than forcing them to come to a different area to get their treatment. That level of convenience, I think, just opens up the proactiveness that patients can take and the ownership that they can take over their healthcare journey. We've definitely seen patients get busier and continue to rely on convenience to serve their everyday needs. We also don't see ourselves as a full replacement for in-person care, and so telehealth really becomes this strong complement to in-person care, where we can make aspects of care that can be addressed virtually a lot more convenient for our patients, give them time back to access in-person treatment when they do need it, and ultimately complement what is currently a very stressed healthcare system overall. The work that telehealth can do can decrease wait times in the physical world as well. So there really is a very strong complement here as technology opens up what patients can do to take ownership over their healthcare.
Yeah, it feels like it has helped out in multiple different avenues, which is awesome. And now, I mean, the pandemic, it threw a lot of us off of our trajectory. I'm sure Wisp is no exception to that. So how did you guys kind of pivot where you were going pre-pandemic, and how did that kind of redirect you to where you are at the moment?
Yeah, so access, convenience, support. These have always been core pillars of Wisp's work. Unfortunately, they're not always present in the healthcare industry. But the pandemic really increased patient demands for telehealth offerings when access to in-person care wasn't available, or wasn't a comfortable thing to think about. If you can imagine the concept of a emergency room in the middle of a peak of a pandemic.
Yikes.
You don't want to treat your UTI surrounded by people that may be passing on a very contagious illness.
Right.
And so the pandemic really provided this acceleration of demand. I think the service that Wisp was able to offer in the early days of that, and as we continue to see that demand grow, provided this example of what really strong telehealth can be, even in a post-pandemic world. And I think that's what we're all referring to when we say the industry has been accelerated maybe
Right.
10 or 15 years.
Okay, yeah, it sounds like you guys are already at the start were, I mean, none of us were prepared for a pandemic world, but thankfully had the tools needed, and this kind of just pushed the company in the deep end, so to speak. It's like,
Yeah.
figure it quickly, help us now. So how does Wisp differentiate itself from other digital health brands out there? Because again, we're in the dawn of them. There's so many.
Yeah, no, it's really exciting to see the number of companies that are opening up here, and I think it demonstrates that there is a huge demand for these services. So we're really excited to see the industry grow the way that it has. Wisp in particular, we pride ourselves on affordability, accessibility, convenience, and ultimately immediacy as well. So our patients choose Wisp because they know that they're going to get the quality care and treatment they need in a time frame that fits their busy schedules. The 50 state coverage is a big one for us that we
Yeah.
worked hard to ensure, and so that broad access, even in these healthcare deserts, is a big thing for us as well at an affordable price point.
So it sounds like if I asked what patients can expect from Wisp, the answer uh, easily is what you need.
Exactly. Well, what you need, and within within minutes of hitting our website, you'll be in touch with one of our doctors.
So what is that website?
HelloWisp.com.
HelloWisp.com. Very easy. Okay, I love that. So what does Wisp have coming down the pipeline?
We've got a lot, amidst the busy holiday season, we're committed to providing our patients with peace of mind, knowing that whatever comes up, our around the clock medical professionals will be there to support. One interesting area that we're looking at is sort of the understanding that sexual pleasure is not only part of being human, but is also a really big part of overall well-being, whether it's mental health or relationship health. And so that's something we're looking to support as well. And one of our recent products there has been the OMG cream. So it's a proprietary product that we've put out that helps stimulate blood flow to the clitoris, and helps sort of work as a female focused Viagra. And support overall sexual health from that perspective as well. That's another line that we're looking to get into.
I within the last few years, I started working with a female sexual health, in the bedroom toy company. And it wasn't until I started doing that I realized just the split in male female comfortability talking about it. And it was really eye-opening. Even as a woman, I was like surprised at my level of surprise. So the fact that you guys are even venturing into that avenue is really just incredible and more necessary than I would have known it was, if I was not professionally involved at some point. So
Yeah.
like I'm smiling ear to ear. I know this is just audio, but I'm so impressed with everything you guys have accomplished already and what the goals are. And do you have any other ones that you could share? What you have coming next quarter, next year? When are you guys running for presidency? Like all that kind of stuff.
Yeah, absolutely. We're doing so much work here at Wisp to advance access to digital healthcare and education around a variety of these sexual health topics. So we're looking forward to continuing this work with Wisp in the upcoming quarter and beyond. We'll continue to support our nonprofit partners to advance the causes of sex education, access to birth control. We also plan to expand our medical abortion offering where it's legal, to ensure that patients are supported while also providing access to the critical medication that they need. So yeah, we're looking forward to continuing to provide innovative and destigmatizing sexual health offerings, like the OMG cream and others that are shortly going to follow in that vertical. Ultimately, promote these conversations around sexual pleasure and empowerment, and really create this future of healthcare that we're all excited to strive towards.
This is awesome. I feel like anyone should support you guys because you support us in every facet we've talked so far, mentally, physically, valuing time, increasing education. There's a lot that you guys take on, and I think that's absolutely awesome. And I appreciate that. I feel like I make jokes all the time with the fiance. Either the kids are going to grow up as adults and be in awe of me, or they're going to be really embarrassed, and that's going to hopefully have to do with the rest of the world and the level of education, around all of us. So if anyone wants to
Yeah.
learn more, again, where can we come check you out?
HelloWisp.com.
HelloWisp.com. Ahmad, Bani, thank you so much for spending time with us and chatting with us on CEO Unplugged. I hope everyone starts doing some Googling right now and gets comfortable having the conversations that we had just now.
Thank you so much. It's an exciting space to be in.
Thank you so much. Take care.